Good afternoon, everyone. I am really delighted to be here today. I'd like to thank Kimberly and Clarion and Patrick for the invitation. And I have to tell you why I'm glad to be here. It's such an interesting topic and one that I care about deeply. But I also have to thank you for the get out of jail free card that you gave to me. There are moving trucks at my house as we speak. And because I had to be here, my husband and children had to carry on the packing and loading duties. So when I say I'm thrilled to be here, I am thrilled to be here. Again, I am Marleece Barber. I'm an internist and occupational medicine physician, and I've spent just about all of my career in industry. And I'd just like to offer myself, there are no slides, just some succinct comments on corporate perspective on the role of businesses, employers, what they do, what they can do. And I'd like to broaden the conversation for us to begin to think about potential partnerships where companies today are eager to engage with other public entities. So as we look at solutions for providing universal health coverage to the global informal workforce, I think there are a lot of things that can be learned from examining the United States' history in this area. There are examples of employer-sponsored health benefits that go back to the colonial days in our history. But it wasn't until the early 1900s that this concept of a partnership between employers, its workers, and government emerged, and for very good reason. And even to this day, as we refine, debate the pros and cons of the Affordable Care Act that was ushered in under the Obama administration, I think one of the good things about it is it started a dialogue, and most Americans are keenly aware of why health benefits are so important. Employer-sponsored benefits really offer its citizens a safety net that can protect workers and their families from catastrophic losses due to unforeseen illnesses. And this partnership between governments, workers, and the people and businesses is of mutual interest. And Lorna has sort of touched on many of these. Businesses need a healthy, robust, energized, and committed workforce in order to be able to develop innovative products and deliver services that consumers really care about. And providing health coverage is a mechanism that directly addresses productivity because healthy workers show up in very good condition to perform meaningful tasks, and workers reciprocate by performing at their peak. And this allows companies to be what they want to be, which is competitive in the marketplace. Government is also very heavily invested in this model because all governments know that in order to be economically stable, we must support our families and businesses. So governments contribute to this model by offering tax incentives to employers who offer their workers benefits. Now, being both an employee and a healthcare provider in three large American companies that have had a large global footprint, I have witnessed firsthand how all of these elements come to play. I've had experience in petrochemicals with Shell Oil, and then agriculture with John Deere and Lockheed Martin in aerospace and defense. And I'm very keenly aware of some of the serious questions that are being raised around the issue of coverage and how much it should be extended. Against the backdrop of skyrocketing healthcare costs, employers are really kind of rethinking what this responsibility means to them to provide coverage, healthcare coverage to the workforce and their families. As it sees its profits erode because of healthcare-related expenditures, more and more companies are looking to governments and their own employees to shoulder more of the burden as they see it. For the employees, companies are asking for greater accountability. for their health status, with more and more employers increasing demands around coverage. And an example of this would be a provision to provide coverage or some benefit, but with a caveat or an attachment, a requirement for employees to reduce their risk factors for chronic disease by refraining from engaging in harmful behaviors, and like smoking, and adopting behaviors that lessen their risk for chronic disease. Now, some of you may suspect that public and private exchanges offer a potential escape for employers to lessen their role in providing benefits. But even as companies redefine what their commitment should be in this area and their social contract with their workforce, productivity remains essential. And as long as that is a salient priority for businesses, there is going to be a role for businesses to play in offering solutions for coverage for their workers and their extended families. I also want to point out that beyond profitability, most corporations actually really do want to be good corporate citizens, and they are very interested in partnering with other groups that are eager to join alliances that are in sync with their core values. And the time has never been better to start advancing smart, collaborative approaches to addressing some of the health issues that affect communities and workers around the world. So it's perhaps here that we can begin to find some clues on how we might go about developing, assisting governments and companies and workers, both formal and informal, in building a healthy, sustainable framework. And what I'd like to do is just take a moment to point out a couple of areas where corporations are doing some significant work and where there is a willingness to partner with like-minded, motivated private and government entities. So if we look at health as the desired outcome, in occupational health services and within medicine and corporations, a more holistic, I would say, public health approach to impacting health is being advanced. And that's by focusing on the determinants of health: healthcare, individual behaviors, social factors, and environmental influences. These promising population health strategies are really changing the way that companies look about where they want to make investments in their people and the communities that they work. So if you look at healthcare, more and more companies and health plans are offering free preventive care to their workforce. And many are even going beyond the walls of their workplace and erecting medical clinics that are in the communities and even hospitals to extend the care to family members and those adjacent to the family members. We also, so with the informal workforce, I also know that that lack of access to care is a significant barrier. I would just point out, and Lorna has covered a lot of this, that as we think about access to care as being a barrier, what we can learn from the American model is as we improve access, we certainly don't want to ignore the implications of affordability, because they have created a crisis in this country. And that comes down to issues of quality of care and making sure that even as we have a goal of increasing access, that we don't offer unnecessary care that really doesn't benefit or change health outcomes. So in the area of a call for personal accountability, we can talk about behavior change. Employers are employing a lot of different strategies to get their own workforce to adopt healthier behaviors. And I think through both education, inspiration, providing tools, and ongoing support, we have been able to see significant gains in some of the changes in behavior in the workforce that has implications for the broader community. This is a ripe area for collaboration between community advocates, businesses, local public and private entities. Investments in education and using schools as a venue to educate young emerging workers on how to live more healthily offer some great opportunity. And I still see a a strong willingness of corporate entities to make an investment in this area. So what am I talking about? Sponsoring events that allow both families and workers to come together to participate in health-related activities and receive some information or services around preventive care. You might consider it an old-fashioned, good old health fair. They still work, and companies are still eager to provide them in partnership with private and community organizations. I'm sure all of you in this room know that one of the most significant or the most significant determinant of health are the social conditions in which people live and the economic environment in which they also live and work. And this is a promising area for collaboration between all the stakeholders because both governments and individuals and the government and businesses co-create this environment. Areas for potential partnership are initiatives like building safer roads. As an employee for John Deere, that was one of the missions that they undertook with significant success in the country of India. There's also keen interest in erecting recreational spaces so that families can thrive and in safety. And there are other corporate initiatives that have already been touched on are those that touch on infectious diseases, malaria, HIV, and bringing awareness to mental health disorders. I think there was a question about what is the motivation behind companies or how do you get them to act. What I am seeing as an internal employee in companies is a cry for and a demand from younger workers for greater activism on the part of their companies. The emerging workforce, at least in this country, I think feels a stronger sense of responsibility for not just the United States or their company, but because of the global world in which we live, there is a responsibility to all citizens in the world. And I am seeing a great deal of grassroots activism that is demanding that they see action on the corporations in which they work to fill gaps where there is a lack of access and coverage for those who are underserved. And again, I said the main point of the comments that I've made today is to begin to open the discussion that we're about to have on how we can partner. I think there is cynicism about businesses, sometimes a questioning of their motives. I would say that you should still look to them to be good partners, strong partners, for not only their workforce, but the informal workforce. They are eager to play that role, and I'm happy to engage on advising you on some tactics that may be successful in engaging that community.
Thank you.
Thank you.
Thank you, Marleece. Comments or questions? Yes.
This is more of a comment or just something to consider just based on what Lorna presented and what Marleece also presented. I think it would be interesting to think about partnership from the perspective of some of the tools that the commercial sector uses, whether it's the insurance models that are used or even the wellness packages that are put together as a form of technical assistance or a way of trying to engage as we all think through how UHC comes together, even in thinking about what kinds of services and at what level of coverage. The example of Levi's is a great one of how collectively they were able to come up with a way of adding coverage with marginal cost. And those tools, independent of being in the commercial sector, may be instructive as people are thinking through various packages.
Lots of them. Yes.
One was with the previous discussion on what large global companies could be doing. We have an example from our own sister Seva in New Delhi where we have a direct link with Gap and monsoon, and the women who actually are home-based and work on the garments which are then sold in this country. And three things. One is that when we negotiated with them to cut out the middleman, which would be much better for our workers, we said, no exploitative wages and no child labor, and the companies agreed to both of these conditions. And slowly, as we began working with them, they also said they'd like to invest in other aspects or support in other aspects, including girls' education, because a large number of the home-based workers were girls. I mean, above 14, but they were girls, many of them going to school and then doing this kind of work at the side as well. So it started with education, but now Gap and Monsoon are quite interested to engage on health. So I think this is an area, this is just an example, this is an area where there could be more partnership, and we need to think what that should look like. I mean, whether it should just be more hospitals. Certainly that's not something that our country needs, more and more hospitals, but how can we actually get better coverage for our people? And the second comment I wanted to make, which I think is a great opportunity in our country and maybe some other countries as well, is that recently by an act of parliament, all corporates, all businesses have to, by law, give 2% of their profits for some kind of poverty reduction and developmental program. And it seems that the top choice for companies is something in the fields of education and health. So again, this is a huge opportunity, and we'd be interested to learn from the experience of the US and other countries what kinds of partnerships and things you have done which actually work.
Thank you. Other? Yes, Victor.
So, excuse me. I've been very encouraged by this conversation, and and the increasing engagement of employers in looking at welfare of their employees. And certainly, I think it should go well beyond corporate social responsibility. It is a fundamental responsibility. The question really is getting the right tools and being able to measure outcomes. I too been very involved with the World Economic Forum, and I think there's just too many people say they're doing a lot of things, but I'm not sure whether one can really show what they do is making a real difference. So, I mean, every CEO talks about putting health gyms in their workplace, enabling all this healthy food, but I think at the end of the day, it's really important to do it systematically with right partnership, being able to measure outcomes. I'd like to push as far as this scenario, that is, employers are willing to post the results. It's a competitive advantage if you create an environment of great health and health coverage for your employees, and being able to see how you do transparently and compared to others. I won't want to go as far as saying this is OSHA, but I'm simply saying that there ought to be an obligation, in my opinion, of large employers being willing to do that, and showcase that we now know we're really going to make big differences, and that in fact it would be, as I said, a competitive opportunity as we do in other areas of healthcare.
Thank you, Victor. I think this has just opened up a very interesting line of discussion, and I think Derek is going to jump right into it. Is that right, Derek?
Yeah. Yeah, let me touch on Victor's point, but I think it goes actually to Lorna's superb presentation as well. I was really thrilled to see you ending off with a focus on sustainability. And I think those of us who've been to World Economic Forum meetings know that the issue of corporate social responsibility has moved on, and we're now focused on triple bottom line reporting, creating shared value, or even performance with purpose, all of which I think are building in what is material to the bottom line of the company into the way they perform. And we saw a lot of progress over the last decade in the UN Global Compact in measuring environmental progress, labor, human rights, but health was not there. And I think this speaks to what Victor's saying. We just completed a commission in the US, including private and public partners, Microsoft, Qualcomm, Humana, a wide range, many of the investment community, who all understood that this was a major omission and that for the future we need to have health metrics reported by CEOs as part of their integrated financial and environmental reports and build that into the reporting structures of the Dow Jones Sustainability Index, the Global Reporting Initiative. And those interested, we have an initiative now underway with those companies and with the major accounting and reporting bodies to make that happen. Of course, it all depends on having effective programs in the workplace, going back to Victor's point.
We've got one more panelist. Would you wait until after the, great. And then I think there's a lot more on that line to discuss. But this is our most challenging because of the technology. Auriel, let me just tell you that you can see her, she can see you, but she can't see me. She can't see us, I think. Is that still the case? Did we just lose her?
Yes, she's being redialed at the moment.
Being redialed, all right. While that's going on, I would like then to pick up on the point that was just said by asking, are there more examples that we're familiar with of what was just said about Sewa and Gap and Monsoon? And just to make that a little bit more precise, one can imagine, it's not too difficult to imagine a corporation looking after its own employees, looking after maybe the ring fence of everybody who lives around their facilities, and creating jobs and supporting transport. But from there, it's a long way for a corporation headquartered in California to be making a serious investment in informal workers who have no formal employment. So if there are those connections, that's great. Are there more of them? How does one encourage more of them? Now, I think the reporting is a terrific idea because there's nothing like transparency to show everyone how they're doing. But I'm going to encourage the topic for our final discussion in this session to come back to that. Are there more examples? What can we learn from them? How can we encourage more? Or do we need to be more challenging to each other that this isn't happening enough and something needs to be done to make it happen more? Now, Ariel, can you hear us now?